Okay, so moving along, I took the backs, you can see, off of the breasts. This I'm just going to cover and put in the fridge till tomorrow because it's 9:30. Here, what I'm going to do here is I'm going to take a few of those with one of these. That's just bones, right? Chicken neck and backs, okay? And a couple, and I'm going to start making some broth, and I'm going to end up making some soup. I'm going to use some of the broth for some ground chicken with broth, right, in the smaller jars. And then I'm going to can 1 pint size jars with that. But with this, I'm going to probably vacuum seal these tonight and get them in the freezer, and then that will be soup for another day. You don't get much money. You don't get much for $76, right? And that was $40 off, people, right? Now you're probably wondering, well, it's chicken breast. Of course it's going to be a bit more expensive than chicken legs. Yeah, you can can chicken legs. I've done chicken legs, but you know, for the price of the chicken legs, minus the discount on that, kind of almost works out to the same. So either or, you know, the cost of food, I'm telling you people, is going to go up. So anytime you can vacuum seal, do that. Okay, so April 30th, 2020, you can see this one will be for ground. This one will be raw packed. So I didn't want to go downstairs into Auntie ShaMay's room and dig around for that canner. So needless to say, my trays are in that canner. So I'm using, as you can see, these lids, right? And then I'll stack something in there. I don't know. Maybe I might have to do 2 separate batches here. Unless, of course, I want to go downstairs, right, and get, what are those things called? Racks, right? I've got this one. I've got those, but I'm probably going to need my other one, unless I just want to do 2 batches throughout the day, which I just might do. I don't know. Because I have to move things to get into the closet, right? And then it's way up high in the back in the closet. But it's getting to be that season because now that I've done this, right, I'm going to have my chicken, right? And then I will, I definitely want to do some beef, right? So what I'll do over the next couple 2-3 months, I'll make plans to buy more jars because I go through them pretty fast, people, right? And I will do maybe $200-300 worth of beef. I'll do ground beef. I'll be doing beef cubes, right? That will be really good. So, but that's like a big shop. You got to spend $200-300, and even then you're not going to get very much on beef. But maybe I'll go to a butcher or something. See what $300 will get me from a butcher. And then after I've done the beef, oh, I want to do some ground sausage. That sounds good. So maybe I'll do that in about 4 months from now, 5 months from now. So you see how you kind of space it out. So whether you're doing your garlic, right, or whether you're doing your chicken, you know, or every now and then stocking up on a little extra honey, right, when you can just kind of squeeze it in. Now, I didn't pay CIBC Bank this month, so I'm not rolling in no dough here. I have a 2-month grace period where I don't have to pay, right? But they're still tacking on that $307 interest on every month. So by the time, you know, if I don't pay next month, because maybe I might want to do the beef, but the thing is, once I've done it, right, I'm feeling pretty good because I have it on hand for a long time. Now, these potatoes, this is 150. This is 50 pounds of potatoes that actually, I really liked them. They dehydrated very, very well. And over the next 2 weeks or so, I'm going to have another bag delivered, and I'm going to do one more bag. Right? Because they dehydrated really, really well. And then, of course, you know, I've got my potato starch for whatever I want, right? In terms of gravies and that type of stuff. So, I don't know if I can even fit this many jars into the canner, right? So, I'm probably looking at 2 batches, and if I'm looking at 2 batches, what I'm doing for the base basically should be okay, I would think, right? So maybe I don't have to go downstairs, because I just don't want to be digging right now, right? But I've only got so much time that I get back outside and plant seeds, right? I'm going to be doing spinaches and, you know, get up in there and anyway, I'm kind of moving slow here, people. Right? I'm just trying to encourage you to keep an eye open for those discounts in your travels. Take a couple, 2-3 hours of your time to either dehydrate, right, or can it, or freeze it. You have a choice. Okay? Okay, so it's a lot of prep work, right? So I took off the bones, you've seen that last night. I vacuum sealed them, put them in the freezer, so they're good to go forever, right? Now, what I'm going to do is I am going to take half the skin, put it right separate, you'll see. I'm going to start chopping this up into chunks and getting them ready for jars, and then I'm going to do 12 1-pint size jars, this size. I'm going to do 12 of those, and then whatever's left, I'm going to grind it up, and then I'm also going to grind up the beef. It's not a lot of beef, but I'm going to grind it up anyway, because the whole point of this exercise is to can, right? I have chicken. I just want more canned chicken for the next 6 months to a year, year and a half, 2 years, because we don't know how the economy is going to go. And being that I'm below the poverty line, people, this is the smartest thing to do. So I'm going to start cutting this up now. Okay. The president's talking. Hold on.
Cases in nursing homes to be reported directly to CDC, and testing data to be posted online so everyone gets to see it. This rule also requires nursing homes to report cases to residents and their family members. And finally, to ensure that our nursing homes are prepared for any future outbreaks, we're announcing the Coronavirus Commission for Safety and Quality in Nursing Homes. This commission will be composed of leading industry experts, doctors and scientists, resident and patient advocates, family members, infection and prevention control specialists, and state and local authorities. It's a big deal. The commission will convene in May and issue recommendations for further steps we can take to protect our nation's seniors. My administration will never waver in its relentless commitment to America's seniors. We owe them a sacred and unbreakable obligation, and we will fulfill that obligation with every resource and power that we have. We are working very hard with our seniors, and we're working very hard with our nursing homes, and great progress is being made, and it will be made, that I can promise you. That's also why we are strongly protecting Medicare and Social Security. We will protect your Social Security, we will protect your Medicare, we will protect you as American citizens, and that goes even beyond seniors. We're protecting this country. Our cherished seniors enrich every aspect of our national life. These great citizens have dedicated their entire lives to our families and our communities and our countries. Our country could not be anything near where it is without our incredible seniors. We'll show them the same love and loyalty they've shown us and they've shown our nation every day of their lives. No effort will be spared to give America's seniors
I like a little bit of fat.
and support and devotion.
You don't want too much because it crawls up the jar. But if you put your jar in a cold, dark area, not so much. Right?
And it's going to designate Older
It'll stay a long
American
time.
Month.
And it's so good.
So this is Older Americans Month. But first I'd like to ask Secretary Azar,
So this is
Wilkie,
it's just going to be a cold pack. So I'm doing 2 separate batches.
Gaynor, to share what
Right?
their
Doing this one
department and
first.
agencies are doing
I'll fill up all my
to help our
jars,
nation's seniors.
and
So
then
just come
whatever's
up
left,
Maybe you could say a few
I'm gonna
words,
grind
and,
it up.
You've made a lot of progress.
and
Alex, what do you say?
I don't know. I might have to go look for more jars. Right?
Well, thank you, Mr. President, for your leadership during this pandemic and for the work you've done throughout your administration to protect
Just gotta
older
put them
Americans.
into little cubes.
I'd also like to thank the older Americans and advocates
Right.
we have here today, including those working hard at the state and local level.
Work fast.
As the President described during this pandemic, we have taken
lot of chicken.
every possible effort to keep older Americans healthy and
Right.
safe. In addition to our public health and healthcare efforts, President Trump has secured historic investments in programs that support older Americans and help them live independently. Over the past month, HHS has dispersed more than $1 billion
Till the healthcare
in
system
grants
gets a
to
hold of them.
aging and disability networks.
It goes after
which
that
are
money.
State and local agencies
Not
like the
addressing
Council on
that.
Aging that provide services for seniors living in the community.
And a lot of their
This is
senior
more than
care
40%
homes in the States
increase
are
in the annual
privatized.
support that we provide to these
Right?
critical
That's why you're
organizations.
having such a problem with so
Services
many
that we support
people dying.
include delivered meals, like my grandmother used to
Right.
get from Meals on Wheels.
There was, what,
help with
60
trips to the grocery
64,
store or the
67
doctor,
deaths in
and assistance with
one
chores in
senior
the
home? Then they were
Back in March,
hiding
we
the
put out
bodies?
$250 million in
Right.
grants specifically for meals, including through Meals on Wheels.
You know, you have to ask
We've been
yourself,
pleased to see communities get creative with
how
these
did that
funds.
happen?
Some states are ensuring not only that the meals are getting to seniors, but that the meals are coming from local restaurants whose businesses are struggling. It's not just about meals
That
and services.
offloading,
We
that's
also
what that is,
recognize
people.
older Americans may be
Privatizing
facing mental health challenges
Government
and feeling isolated.
responsibilities.
Florida's Aging
Right.
Network, for instance, is combating social isolation by providing electronic tablets to nursing home residents
Yeah.
to help them communicate
5G,
with loved ones.
electronic tablets.
We're also working to
Bringing
protect
in
the rights of
5G.
older Americans in accessing health care. Our Office for Civil Rights has been taking action to ensure that states and healthcare providers do not discriminate on the basis of disability or age in the allocation of medical care. We've already had 2 states remove such discriminatory policies from their triaging guidelines as a result of our Office for Civil Rights work. Finally, as the President and others mentioned, we've worked closely with states to ensure that they can test especially vulnerable populations like those living in nursing homes and those who care for them. This work to protect seniors and empower them will continue throughout the pandemic as we reopen our country and keep America's seniors as healthy and as independent as possible. Thank you all for what you do in this effort. Thank you.
Mr. President, thank you, and thank you for everything you have done to transform the Department of Veterans Affairs on behalf
That's
of the
another big
nation's
one.
9.5 million veterans. 75 years ago, the men of the 28th Marine
About an
Regiment
inch.
raised the American flag on Mount
Right.
Suribachi. No event better evokes the sacrifices and the triumph of the 15 million Americans who put on the uniform during World War II. A few years after Iwo Jima, the soldiers of the United States 8th Army defended the Pusan perimeter, and Marines fought through and out of the Chosin Reservoir. Veterans of those terrible times are still with us today.
You keep the
Early
skin.
on in
You
this
can render
crisis,
it
President Trump
and
gave
make a
very
nice
explicit
fat and
to do
fry your
everything
potatoes in it. And then
possible
what you're gonna get
to protect
is like
lives
the
of
good
those
old days with the French
precious
fries
Americans.
when they used to fry them in
Department of
chicken
Veterans
fat.
Affairs
Oh,
has
they were so good,
134 nursing homes,
right?
but more than half of
So-
the residents in those nursing homes
You can always freeze the
fought
fat
in wars,
and render it later,
battles with names
Right.
like Guadalcanal,
which I might do.
and
Some of it
Bulge,
though, I'm gonna
and
probably grind it right into the
78,000 residents in our nursing homes, we have tested
meat.
all of them
right,
for the coronavirus.
because
We
it
have
makes it
tested all of our
flavorful, right?
staff.
I can mix it in with the
Our
beef
infection
a little
rate is
bit.
low.
No matter. I have to see
Many
how
of
much
our homes
chicken I'm going to have
few
left.
or
I have a
any
fair amount here,
positive cases.
right?
But still, as the president
I don't know what
noted,
kind
we
jars
had to
I have
make a very
downstairs.
tough decision early on. After all of these veterans had gone through so much on the battlefield,
Because I remember
we
I
had to
brought up,
tell them
what,
at
2
this
or 3
stage in their
cases
lives that we were depriving them
of,
of the
I
sustenance
was doing
of their
something. What was I
families and
doing?
friends
I was doing
because
something there.
we had to protect their lives.
Can't remember now.
Because of the president's directions to me, we have been able to contain the virus in our nursing homes. And now, we are taking those lessons that we've learned from VA across the country to protect patients across America. We are the federal experts in gerontology. We are helping 38 states and territories handle the surge of patients dealing with this virus with our partners, our great partners at FEMA, and even by direct action through the governors. Aiding America's elderly is central to all of our efforts. We deployed VA staff, as the president noted, to veterans' nursing homes owned and operated by the individual states. Early on, Governors Charlie Baker and Phil Murphy moved to protect their veterans, and they asked us for help. In addition to Massachusetts and New Jersey, we were helping in Alabama, Florida, and Tennessee. In California and Mississippi, New Mexico, Oklahoma, Rhode Island, and Texas, we have taken in non-veteran nursing home patients and state veterans nursing home patients into our VA facilities. We are helping elderly Americans wherever we find them. Mr. President, you should be very proud of this VA that you have helped build. Thousands of VA employees have leapt into harm's way. VA leaders like Julie
Andre,
McInerney and
I'm
Martina
recording this.
Parada in your
Okay, turn that
hometown.
down. I don't want to hear that.
Ryan Little
I'm
in Boston,
listening to the president
David
talk.
Nelson in Detroit, Vicki Vaughn in Illinois and Wisconsin.
What kind of video is this?
Fernando Rivera and Sky McDougal in New Orleans, and Miguel Lapuz in Florida. All of them have put service before self to protect the most vulnerable and deserving. These are the folks who made America strong and free. Thank you very much. Thanks.
Thank you, Mr. President. And thank you for your commitment to the nation's seniors and to the Medicare program. You've been very clear with me since day one that you wanted to protect and strengthen the Medicare program. And under your leadership, our Medicare Advantage program is seeing premiums at a 13-year low, and in our Part D program, it's a 7-year low. But today I want to focus on nursing homes. In the scheme of life decisions, placing a loved one in a nursing home has to be one of the most difficult decisions. And when you make that decision, you want to know that you can stay connected with your loved one and that they're going to be safe and have the best quality of life. And that's why the decision to restrict visitation in nursing homes was a heartbreaking decision. And our thoughts and prayers are with the families and the patients.
Well, we know how I feel about that, people.
But the tragic
They
reality
removed the
is
witnesses.
that the coronavirus seemed almost tailor-made to put major pressure on
A lot of what's
nursing
going
homes.
on is just
Countries
politics.
across the world have struggled with their
Yep.
nursing home populations.
And these politicians that don't want to
Action around nursing
you know,
homes has
kick
saved
the butt,
countless
butt
lives.
like,
And even
you know,
before
bucket.
the
They don't want to
coronavirus,
buck,
we
right?
have been working
Because they
on
don't
a
want to lose their
strategy to improve
their,
quality in nursing homes. The strategy focused
position.
on quality,
They don't want to be
oversight,
voted out.
enforcement, and transparency for patients and their families so they understand
So they don't want to
exactly
risk
what's going on in nursing
going
homes,
against
about the conditions
the so-called norm right now.
reducing regulatory burdens so that nursing home providers
But
can
this is
focus on
all
providing care for
manufactured
patients and
poverty,
paperwork.
where they're going to be targeting
We've
people now,
overhauled the entire
most definitely,
survey system
because
and
they've been doing
implemented
it
a common tool
through the
across
healthcare
the
system.
entire nation to ensure
Just-
that our
they're just making
inspectors
it
were being
easier.
consistent,
That's all they're
objective,
doing.
and that's actually resulted in an increase in the number of fines.
You have to remember,
And we've
Trump
updated
won't
our
be
website
around
so that patients
in,
and their families have the latest information on the quality in a nursing home and making
You know,
it very clear when nursing
10
homes
years from
have
now.
significant cases of abuse and neglect.
Right.
And those improvements that we've made made
He'll
it
be
possible
insignificant.
when the coronavirus hit for us to take very rapid action on several
Right.
fronts. We launched an unprecedented
Even the
transparency
Obama
effort,
just
and that
disappeared.
requires nursing homes to inform patients and families when there's an outbreak in the nursing home, and to also report that information directly to the CDC.
But
And
the
that's
agenda
gonna be
will be in
important
place.
to our efforts around surveillance
Unless
going
people
forward
fight back.
as we
And
reopen
right
the
now, they don't
country.
want to fight back.
And also, we increased reimbursement for labs so that they could do more
We're
testing
falling
in
for
the
the
nursing
old
home.
okie dokie.
And that's going to be very critical, as I said before, to our monitoring and surveillance efforts. Also, starting in February, we issued a series of 9 guidance documents specific to coronavirus and controlling infections in nursing homes. And just for some perspective, normally these types
So,
of guidance
the whole country
documents
went on
take
lockdown
months,
for the
sometimes
elderly.
years.
So that the elderly can die by
Days
themselves.
and nights and weekends to make sure we got this information in the hands
Right.
of our nursing homes to do everything that we could to protect our vulnerable seniors.
Yeah.
And we also host weekly calls with the nursing homes to help them implement our guidance. But federal action is just one part of the piece. States ultimately license nursing homes, and that's why we've been working with states to investigate
Boy, there's a lot of
outbreaks
chicken
that are
here.
going on and inspect nursing
I'm
homes.
glad I bought it though.
And our guidance has called upon state and local leaders to
I'll
support
feel good
nursing
tomorrow
homes
when this is
in
done.
their efforts to control the coronavirus outbreaks. And I commend
Right.
Governor Lee and governors across the nation.
And then,
that
like I
have
said, I'll
implemented
budget
our
in
guidance,
a whole bunch of
whether
beef.
it's cleaning their facilities,
And then I
testing,
wanna
and
do
creating
sausage.
new COVID facilities, and that helps isolate patients that are sick and keeps
Right.
other patients safe. And this work has been
one jar
critical
is
to keeping nursing homes
good for one
residents
meal.
safe. And I'm pleased to announce that we are putting
Right.
out new state grants to support state and local efforts to nursing homes. The president has been an advocate of this. He has asked for increased funding to inspect nursing homes every year in his budget. But this is the first time that Congress has provided this funding. And the money couldn't come at a more critical time when it'll be important to work with our state partners to ensure safety in our nursing homes. But the president has directed us to do more, and so as part of our Opening Up America efforts, we are going to oversee the Coronavirus Commission for Safety and Quality in Nursing Homes. And the commission will comprehensively assess the response. It will identify best practices and also provide recommendations for how we go forward to protect our nursing home residents and make sure we are providing the best quality of life. And in closing, I want to speak directly to our nursing home residents, their caretakers, and their families. Your pain is our pain, and we are doing everything we can to support you. And to the healthcare workers on the front lines, providing care and comfort to our nursing home residents.
Yeah, I might have to go look for some more jars.
Thank you, Mr. President, for your consistent leadership and unwavering support for our elderly citizens.
Or maybe I'll grind it up and freeze it that way after I do my last batch
That's right.
in the canner.
We're doing everything we can to lower the price of insulin for our seniors, and we'll have some great announcements coming up very soon to lower the price.
Thank you, Mr. President, Administrator Verma, and members of the Coronavirus Task Force. Let me focus on the logistics in our effort to deliver personal protective equipment.
We're listening
care
to this,
packages,
people, because
to
it's
those
important.
citizens at highest risk and greatest need, those living in our nursing homes across the country. Thanks to the leadership of the President and the tremendous support of the White House Coronavirus Task Force, FEMA will deliver care packages containing 4 items of PPE to more than 15,000 Medicare, Medicaid certified nursing homes nationwide, to include the District of Columbia, the Commonwealth of Puerto Rico, and Guam. Given the lack of availability of PPE necessary for healthcare workers providing support for nursing homes, we will provide a package or a kit containing a 7-day supply of eye protection, masks, gowns, and gloves to these 15-plus nursing homes. Each kit is individualized for each nursing home based on the level of staffing and the 7 days of our supply calculation. Over the course of the next 60 days, we're providing each of the nursing homes with 2 separate shipments of 7 days of supplies, totaling 14 days of supplies by the beginning of July. The first shipment of supplies begins next week. These initial shipments will focus on metropolitan area sites such as New York City, Northern New Jersey, Boston, Chicago, and Washington, D.C. The second shipment of supplies begins in early June. The goal is to have all supplies...
No fact-checking, though, right? No autopsies, eh?
Assisting us in this
Right?
endeavor
No
is federal
independent
resources.
autopsies,
A
right?
small
To see if
business
the
based
numbers
out
are
of
fudged, right?
Kingsville, Maryland, who
Notice that, eh?
specializes in chem bio equipment support with
What are they
focusing
doing
on
with these
kitting
contaminated
solutions for the
bodies?
Department of Defense. They will help us distribute the following PPE items: 608
Assuming that they're
1,000
contaminated.
pieces of eye protection, 6.9 million surgical masks.
Are organs
6.4
being harvested
million
from these
gowns,
bodies? I'd like to know.
31.4 million
They're not
pairs of
talking about
gloves.
that.
And finally, I would again like to extend my gratitude to the President for his leadership on this project, as well as to thank my fellow members of the White House Coronavirus Task Force and their continued partnership. Together, we have turned a critical demand for PPE.
That
for our
will
seniors
be
and
almost
frontline
enough, I think, to
healthcare
fill up
workers into
the
reality.
jars that I have maybe right now. I might have to go buy another box of jars. Yeah. Might have to. It's worth the investment, though. Right. This is more than planning for a rainy day. Okay? We're not out of the woods yet. You know they have a phase 2 coming. Okay? They're just trying to drag out phase 1 right now. And then when they come back with phase 2, they're going to come back even harder. Right? I guess that's it. Show all 10
Well,
and
thank
stuff.
you very much.
Oh, wait.
I'd like to have some questions maybe
No,
on this.
let's listen
and,
to the questions.
We might venture
It's okay.
into different territory also, I think. John, please.
All right. I think
Not a wise one, but it's an adventure.
I'll just do one more just to be safe, and if I need to, I can come back and grab. I'm gonna put those ones in the fridge, and I'm gonna wipe this down and get my jars. Start filling up my jars. Right? You don't put water when you're cold packing. You don't need water. You don't need salt. I don't know where my salt is, like in my
Well,
thing
I'm going to have
thing.
to talk to the Vice President,
So?
but I'll tell you what, General Flynn was under enormous
Probably have to
pressure.
look
and
for
it was
it.
an artificial pressure because what they did to General Flynn was a disgrace. Well, it was a total disgrace. It's shocking. And I hear even more information came out today. What they tried to do to destroy him and to hurt this presidency was
I don't know what
perhaps
he's
in our
talking about.
country's history, there's never been anything like it. An absolute disgrace. But I'll rely on what the Vice President said. I can say this, and I think you understand this, John, very well. What happened to General Flynn should never happen again to a citizen of this country. Yes, please.
Said that Michael Flynn would come back even bigger and better. So are you going to pardon him? And if so...
I don't know who
consider
this
bringing
person
back
is.
into your
Well, it
administration?
looks to me like Michael Flynn would be exonerated based on everything I see. I'm not the judge, but I have a different type of power. But I don't know that anybody would have to use that power. I think he's exonerated everything. I've never seen anything like it. What they did, what they wrote, you see this, General. You wouldn't want this happening to you, what they did to General Flynn.
General
And
Flynn.
it's just disgraceful. So, you know, I guess we'll get to that maybe someday or maybe
Hey.
not. Hopefully we won't have to get there.
Bringing him back into your
See?
administration?
Well, I think he's a fine
This can
man.
be
I think
rendered.
it's terrible what they did to him. It's
I can
something
add
that
in a
nobody's asked
little
me, but
extra when I
you
do
asked me
that
for the
beef.
first time, I would certainly consider
I can grind it in right
I
in
think
with the
he's-
beef and
I
it will
think
make
he's
it
a
flavorful,
fine
right?
Man, I think he's got a great family. He loves his son. I will tell you, his son was around a lot, and he loves his son, as people generally do. And they did everything possible to destroy him. And he's still breathing very strongly, but they really hurt him very badly. Very, very unfair. Kristen?
Quick follow, in what capacity, I do have a coronavirus related question, but in what capacity did you bring him back?
Well, we look. I mean, I'm not
just
even-
showing
this is
you
really the first
how
time
fast
I've
you
been
can do
asked a
this
question. But
for yourself.
I think he'll be fully exonerated one way or the other, and so certainly he'd be capable of coming back.
see?
He suffered greatly.
Right? I'm going to put that in the fridge, and I'm going to start filling up jars as soon as I clear this off.
They said that the government was
Do a
Okay,
phase 4,
so out of all that chicken, I have one
we'll think about what's happening. They want to help the states.
a half a breast left.
The
That's it.
bailouts are very tough, and they happen to be.
So that worked out pretty good.
Democrats
So I wiped the
states.
rims. I put in
It's
a half a
Illinois,
teaspoon of
it's
salt.
Illinois, and,
Right? I'm debating whether I want to go back to the store.
Strong check,
I got to
you know.
make sure I have my rent first.
Or is it just a
I might go back,
But the Republican
right?
run states are.
Because
Look, I looked.
You know,
today,
this is
when
just something I
spoke
want to
with
do.
Ron DeSantis, who was here yesterday, as I said, and
All right, spend another $30, do one more batch,
he's doing it.
and I'm good
Two states are doing unbelievably
till
well.
next month or whenever, right? And then, like I said, I want to do
We had a
a
call
big batch of beef,
from the governor of
right?
South Dakota.
But
And they have one
we don't know what's on
in the
sale
state.
today,
They have
so I might go back. We'll
We'll
see.
You know, they have to have a
Look at that.
balanced budget.
And then when you put your lids on,
They just have a sales tax.
you don't have
There's
to,
a sales tax. So they think
What do you
of it,
call
it's
that?
a whole different thing. But
you don't have
Republican
to
states are doing very well. Maybe the Democrats should have brought this up
disinfect your jars when you're using a
Earlier.
pressure canner.
when we
right.
wanted certain things.
And when you put on your lid,
And they did.
no
and I
water,
said, and I
not in
said
this.
specifically,
It will create its own.
Look at it later on down the road. But
And when you
like
put
the
that on,
construction,
just
they wanna
finger
do
tight
infrastructure. I can understand
for the
infrastructure.
newbies.
Think of it. we
Don't
spent $8
because
trillion
your
in the
jar
Middle
will
East.
want to release
And we're
pressure
not
and liquid and
fixing
whatever,
the
and
roads in this
it will
country.
just
How
crack.
stupid. How
So
stupid
you
is
need
it?
to just
And we're
do
not fixing our
some
highways,
loosely,
our tunnels, our
just
bridges,
finger tight. That's it.
hospitals even.
Okay, so now it's in the canner. Right, feeling pretty good about that. This is my old school one with Uncle John, right? I didn't want to go downstairs. So it's just, you know, vent it for 10 minutes, right? And then put that on there. And when it starts to jiggle, turn it down a bit, right? And then just 75 minutes at least, because it's a pint. Okay, so this is the end of this video. I'm satisfied with this. I'm not going to buy no more meat right now. I'm going to work on doing the beef later on. I have turkey downstairs in the freezer. I forgot about that. Before I do anything, I'm going to take out turkey in the next few days, unthaw it, and then I'm going to can. And it works out to about $5.50 per jar.